Every year, millions of people face one of the most lethal health threats: heart attacks. In the United States alone, more than 300,000 deaths and 1.4 million hospitalizations are recorded due to heart attacks, overwhelming the health system and impacting entire families. Heart attacks are one of the leading causes of death in the world, and the situation is even more worrying for those who already live with conditions such as diabetes, high cholesterol, obesity, and hypertension. These risk factors increase the chances of heart problems, but there is another point that few people know about: the impact of certain medications on the heart. Many medications used on a daily basis, especially those for pain and inflammation, can significantly increase the risk of heart attacks, especially in those who already face cardiac risk factors. This is a situation that requires extra attention. Common anti-inflammatories, such as ibuprofen, naproxen, and diclofenac, are widely sold and used. However, their frequent use and in high doses can be harmful to the heart. When these medications are taken without medical supervision, cardiovascular side effects become a real threat, often unknown to those who use them. To reduce these risks, the general recommendation is to use these anti-inflammatories in the lowest possible dose and for the shortest time necessary. Non-steroidal anti-inflammatory drugs, known as NSAIDs, are among the most widely used medications in the world to combat pain and inflammation. Available without a prescription, they offer quick relief from muscle pain, fever, and other conditions, but they carry risks that not everyone is aware of, especially for the heart. Studies indicate that prolonged use or high doses of NSAIDs can increase the risk of cardiovascular problems, such as heart attacks and strokes. This risk is even greater in people who already have a history of heart disease, high blood pressure, or high cholesterol. Even in people with no history, continued or excessive use of these medications can cause silent damage to the cardiovascular system. Common medications, such as ibuprofen, naproxen, diclofenac, ketoprofen, and indomethacin, are part of this category and are widely available. But the problem lies precisely in the ease of access. Many people take them on their own, without medical advice, believing that they are harmless. When used indiscriminately, they can compromise blood flow, raise blood pressure, and cause fluid retention, factors that overload the heart. For those who already have risk factors or are undergoing treatment for heart disease, the recommendation is to use NSAIDs with great caution, preferably under medical supervision. In cases of mild pain, alternatives such as paracetamol may be safer, as they do not present the same cardiovascular risks. Therefore, before self-medicating with anti-inflammatories, it is essential to think about the possible impacts on the heart and consider other options, especially if there are any risk factors involved. Although non-steroidal anti-inflammatory drugs, NSAIDs, provide relief from pain and inflammation, it is essential to consider safer alternatives for those with cardiac risk factors. Paracetamol, for example, is a recommended option for treating mild pain and fever. It does not present the same cardiovascular risks associated with NSAIDs, making it safer for use in those who already have cardiac conditions or risk factors. To ensure safety, the use of any medication should be done with caution and always according to a doctor's instructions. It is important to remember that even common medications can have harmful effects when used excessively or for prolonged periods. Taking medications rationally, respecting the indicated doses and times, reduces risks to the heart and prevents unexpected health problems. In addition, it is essential to inform the doctor about all the medications you are already taking. This precaution avoids unwanted interactions and allows the professional to evaluate the safest options for each situation, especially when the heart is already overloaded. Maintaining this dialogue with your doctor and seeking alternatives such as paracetamol is a way to preserve your health and reduce the risk of complications. Aspirin is widely known for its clot-preventing effect, which makes it an important ally in protecting against heart attacks and strokes in people with high cardiovascular risk. Unlike other anti-inflammatories, it acts directly on blood platelets, helping to prevent the formation of clots that can block blood flow to the heart. However, despite its benefits, aspirin should be used rationally and always under medical supervision, as it can cause side effects, such as bleeding and gastric problems, especially in high doses or with prolonged use. For those who do not have cardiac risk factors, regular use of aspirin can bring more risks than benefits, so it is essential that the decision to take it is made under medical supervision. The safe use of aspirin and any other medication involves following appropriate dosages and discussing with your doctor the real need for its consumption. Drug interactions are a crucial point for heart health. Combining different medications without medical supervision can increase the risk of side effects, especially in people with cardiovascular risk factors. Certain medications, when taken together, can intensify or reduce the action of each other, causing problems such as high blood pressure or overloading the heart. Therefore, it is essential to inform your doctor about all the medications you use regularly. This care allows the professional to evaluate possible interactions and adjust the treatment to protect your cardiovascular health. Taking care of your heart is more than just avoiding harmful habits. It also involves the conscious and informed use of medications. Cardiovascular health can be affected in unexpected ways when we are not careful about what we consume. Remembering to consult your doctor before self-medicating and understanding the risks and safe alternatives is essential to protecting your heart and your health as a whole. If this content was useful, subscribe to the channel for more information on health and well-being. Turn on the bell so you don't miss any important tips and share this video with anyone you think could benefit from this information. Taking care of your health starts with knowledge.